Hello, and thank you for joining the Employee Education Meeting for members of Advantage Health Plans Trust. This presentation is intended to be an educational opportunity for employees in preparation for their next plan year. Advantage Health Plans is not a traditional, fully insured insurance plan, nor is it backed by one of the big insurance carriers like Blue Cross, United Healthcare, or Aetna. Instead, Advantage Health Plans is owned and operated by the participating employers. This plan is self-funded. So the participating employers directly take on the responsibility for paying the claims incurred by members of the trust, rather than purchasing an insurance product to shift that responsibility to a third-party insurance carrier. Each month, each participating employer makes a contribution to the trust relative to the risk category that they are assigned for that year. That contribution can either be higher or lower for each employer, depending on the expected claims for that group. All of the participating members own Advantage Health Plans. Throughout the year, as we all make our healthcare purchasing decisions, any dollars that are saved stay in the trust and are available to offset potential future rate increases. The risk categories displayed on your screen represent the various levels of contribution that each employer makes to the trust. To find out what risk category your employer is in, you can contact your HR department. Advantage Health Plans offers multiple different plan designs with varying levels of benefits. Your employer can assist you with identifying what plan is offered to you and what corresponding cost of that plan is. To view a current summary of benefits and coverage, or SBC, please visit AdvantageHealthPlans.com. There are some benefit enhancements that the trustees of Advantage Health Plans have approved effective January 1st, 2019. The first is what we are calling an all-inclusive office visit. Currently, on any plans that have a benefit for an office visit copay, if a participant has a minor procedure done while in the office visit, the minor procedure will be subject to the major medical benefits, which are deductible and coinsurance, whereas the office visit is subject to the copay. So oftentimes, participants do not expect or anticipate to owe a deductible or coinsurance from an office visit. But because of the minor procedure being performed, the additional patient responsibility does apply. However, effective January 1st, 2019, some minor procedures will be bundled under the office visit and included in the office visit copay. For more information about whether or not a procedure that you need applies to this office visit, you can contact Advantage Health Plans Trust. Next, there will be a change to the physical therapy, manipulative therapy, and chiropractic benefits. The maximum reimbursement allowable for providers for a manipulative therapy visit is currently $75 per visit, and that is increasing effective January 1st, 2019 to $95 per visit. Additionally, physical therapy offered after a surgical procedure is currently subject to deductible and coinsurance, but starting January 1st, 2019, all physical therapy for participants enrolled in a copay plan will be subject to an office visit copay. There will now be some coverage for CPAP replacement supplies. Currently, CPAP replacement supplies are non-covered expenses, non-payable by the benefit plan. However, effective January 1st, 2019, participants who can show documentable compliance with their CPAP machine will be subject to the regular durable medical equipment benefits of the plan, which are deductible and coinsurance. For participants that choose to seek treatment for sleep apnea through the KPPFREE program, CPAP replacement supplies are covered at 100% with no patient responsibility. For eligibility for this benefit and to set up your appointment, contact Advantage Health Plans. Participants will now have a limited hearing benefit under the plan. Hearing loss services and devices for medical diagnosis other than sensorineural hearing loss will now be covered with a maximum limit of $2,500. Preventive screenings for Affordable Care Act mandated services, such as screening colonoscopies, bone density scans, and screening mammograms, which have an attained age requirement, will now be covered before the attained age under regular major medical benefits, which are deductible and coinsurance. For those age requirements and frequency limitations, please view your summary plan description. Here is a sample of your Advantage Health Plan's member ID cards. Please make sure your medical providers have an updated copy of your member ID card, and when you receive a new card, please destroy your old one. Importantly, on the front of your ID card is the PPO network that your employer has chosen to access. Be sure to check the network status of your medical providers prior to seeking medical care. You can check network status in the following ways. 1, contact your medical provider and ask them whether they participate in the PPO network that you access. 2, visit AdvantageHealthPlans.com. From the quick links on the home page, click on Find a Doctor or Pharmacy, then scroll down to the list of provider networks and select the corresponding network that matches your ID card. Or 3, contact Advantage Health Plans. Please note that there are some providers that are excluded providers for Advantage Health Plans. Even though Advantage Health Plans uses a network to access local providers in the communities where the participating employer seeks medical care, the network negotiated price may not always be the best price. It's important to understand the role and operation of the network. Networks serve a function to negotiate discounts off of medical provider services in exchange for funneling volume to these providers. However, the medical providers determine their billed charges from which the discount is applied. In any given geographical area, different providers can charge different rates for their services. So the starting point is a varying number depending on which medical provider is chosen. Even if steep discounts, such as 50% off of billed charges, are negotiated by the network, 50% off of a higher starting number may still not represent a fair price. For example, 50% off of a $1,000 price is still more than 50% off of $100. Additionally, oftentimes the network negotiated price is not the best price that the medical providers offer. Oftentimes, their best price that those medical providers offer is a cash price to cash-paying patients who don't access networks or health insurance through insurance carriers. So accessing a network provider does not always guarantee a valuable price. Here's an example. The bills displayed on your screen are bills from a patient who had a medical procedure done at a hospital in Pennsylvania. The patient had not provided their medical insurance ID card that indicated the network they accessed to the hospital prior to their procedure. Therefore, the patient was coded in the system as a self-pay or cash pay patient. The patient received a bill for the medical services in September for $1,000. Thinking there would be a better discount for using his medical insurance, the patient provided his insurance member ID card to the hospital and asked them to refile the claim with his insurance company, allowing him to access the network discount. The hospital did so and issued a new bill in December of the same year. The new charges for the patient after the network discount are $1,752.80. The charges for this patient are higher even after the network discount was applied and the medical insurance was added to the charges. Advantage Health Plans provides solutions to these problems and provides alternative options to help patients make better healthcare buying choices. Participants have access to education and tools such as Healthcare Blue Book to assist with these healthcare purchasing decisions. Participants can also access the KPP-Free program, where medical providers are covered at 100%, waiving all patient responsibility. The types of medical services that can be covered under the KPP-Free program are orthopedic, imaging, general, urology, ENT, gynecology, even oncology and cardiac, bariatric, digestive, eye, pain management, physical therapy, sleep, and more. Using the KPP-Free program is as easy as 1, 2, free. Any participants that are interested in learning more about the KPP-Free program can contact Advantage Health Plans and speak to a Kempton Care Advocate. Step 1, when you and your medical provider begin discussing some needed medical procedures and an order is given for that procedure, that's when to contact Advantage Health Plans and speak with a customer care advocate. Step 2, should you decide to move forward with the benefits under the KPP-Free program, you will receive a voucher that you'll provide to your KPP-Free provider at the time of your appointment. In Step 3, procedures or services done through the KPP-Free program are covered at 100%, waiving all patient responsibility. Under IRS guidelines, with the exception of ACA-mandated preventive services, participants enrolled in a qualified, high-deductible health plan must meet their deductible before receiving a 100% benefit. Also, this program is for non-emergency situations. For emergency situations, please seek medical assistance immediately. You can refer to your plan document for more information about emergency benefits. The KPP-Free program has grown from one provider in 2012 to almost 100 providers across multiple states. For a complete and up-to-date list of providers that participate with the KPP-Free program, please visit KemptonPremierProviders.com. It's very important that you speak with a Kempton Care Advocate if you are interested in seeking benefits through this KPP-Free program. Displayed on your screen are some examples of the difference in cost that providers give networks access to versus the bundled cash rates that are available for these same procedures through the Kempton Premier Provider or KPP-Free program. For example, let's take a look at a laparoscopic gallbladder removal on the left side of your screen. We routinely see billed charges for this procedure total over $39,000. Thanks to those steep network discounts, health plans accessing these providers through PPO networks only pay $35,000. That's an incredible discount of $5,000. But typically, cash pay patients would only pay $6,550 for the same procedure. Providers who participate in the KPP-Free program are offering participants of Advantage Health Plans their best cash price. Another example for a diagnostic colonoscopy. We routinely see billed charges for claims for a diagnostic colonoscopy at over $19,000. After the PPO network discount, those charges are discounted down to $15,000. However, cash paying patients typically pay around $1,800. With these two examples, you can see why Advantage Health Plans Trust has chosen to offer an enhanced benefit covered at 100%, waiving all patient responsibility to patients who choose to access their medical services at KPP-Free providers who offer transparent, bundled cash pricing. The program has been wildly successful since its inception in 2012. There have been over 7,000 procedures performed through the KPP-Free program, and the plan has experienced a total claim savings of almost $15 million. That savings doesn't even factor in the additional patient responsibility or those deductibles and coinsurance that were saved by the participants due to the enhanced benefit. We routinely redirect approximately 600 procedures per month through this great program. For benefits and eligibility for the KPP-Free program, please speak with a Kempton Care Advocate at Advantage Health Plans. And remember, this program is voluntary. An extension of the KPP-Free program is the cash price agreement. The cash price agreement allows a participant to participate in the KPP-Free program at any provider if the provider is willing to match the KPP-Free price. Participants can contact Advantage Health Plans to speak to an advocate and get a customized cash price agreement to send to their local provider. For procedures done under a cash price agreement, the benefit will be the same as the KPP-Free benefit, which means the patient responsibility is waived and 100% of the procedure is paid by the plan. You have other 100% benefits available to you through Advantage Health Plans. For diagnostic imaging, such as MRIs, CAT scans, and PET scans, participants who use KPP-free or one call for those procedures are eligible for an enhanced 100% benefit. Additionally, lab work processed at a lab, such as Clinical Pathology Laboratories, CPL, or through the lab card program at a Quest Diagnostics or DLO laboratory are also covered at 100%. Some over-the-counter medications that treat allergies and indigestion or heartburn are also covered at 100%. Participants must still have a prescription for these medications, and they must be filled by the pharmacy. For more information about your enhanced 100% benefits, you can consult your plan document or contact a Kempton Care Advocate. Remember that under IRS guidelines, with the exception of ACA-mandated preventive services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving any 100% benefit. Participants of Advantage Health Plans also have access to a great tool to assist in identifying the cost of medical procedures at providers in their local geographical area. Healthcare Blue Book has a desktop website and a smartphone app. You can go to the App Store and type in Healthcare Blue Book to download the app. To log into the desktop website, you can visit AdvantageHealthPlans.com. From the quick links on the home page, click on Healthcare Blue Book, then log in using your first and last name and your member ID. When participants use Healthcare Blue Book to identify fair price providers, you could be eligible for a cashback payment called a Green Reward. Green Rewards are paid to participants who choose to have certain procedures done at premier providers. These procedures may still incur a patient responsibility, such as deductible or coinsurance, but the participant will be accessing a better price for these medical services, and the plan will share a portion of the savings by paying a cashback Green Reward. The rewards range from $50 to $100, depending on the type of medical procedure. Remember that Advantage Health Plans has some additional medical services with reference-based limits. It is very important to contact a Kempton Care Advocate prior to seeking any non-emergency medical procedures so you can be informed of any additional plan limitations. For example, out-of-network medical services are covered at the same benefit level as in-network medical services, but the plan allows the provider to be reimbursed at a percentage of Medicare. Physicians are reimbursed at 120% of Medicare, and facilities are reimbursed at 150% of Medicare. Participants should contact out-of-network medical providers prior to seeking those services to ensure that the provider will accept the plan allowable as payment in full and not balance bill the patient for any difference. Additionally, implantable medical devices are limited to a plan payment of invoice plus 100%. What that means is that when Advantage Health Plans receives a claim for a procedure that involves an implantable medical device, we will promptly request an itemized bill. That helps us separate out the implant charges from the rest of the facility charges. The facility charges are paid at regular benefits. Then the implant invoice is requested. The plan will allow the medical provider to recover 100% of the cost of the implant subject to the implant invoice, plus an additional 100% profit. Any difference between billed charges versus the reasonable plan allowable could be balance billed to the participant. It's important to seek a commitment from the medical provider to accept the plan benefit prior to having non-emergency medical procedures that involve implants. You can see some other medical services with reference-based limits on your screen. Let's look at an example of some charges for implantable medical devices. Recently, we received a claim for a spinal procedure that totaled over $132,000. Of the total bill, almost $90,000 was the implantable medical device. We requested the itemized bill and implant invoice and identified that the provider paid $9,000 for the implant. Therefore, the allowable under the plan benefit would have been $18,000. This means that medical provider billed your self-funded benefit plan $90,000 for an implantable medical device for which they paid $9,000, and the plan would have reimbursed them $18,000. The participant could have been balance billed for the remaining $70,000. Now, in this example, the medical provider did end up accepting a settlement and the participant was not balance billed. Here are some final reminders about how you can talk with your physicians about cost. Always remember to tell your medical providers that you are on a self-funded benefit plan and you would like to know what the total cost of your medical treatment will be. Remember that your Kempton Care Advocate can also assist you with identifying your benefits in your plan design, but as a participant on a self-funded benefit plan, you should be asking for the total treatment cost before you have any non-emergency medical procedures. Remind your providers when talking about self-funding that your employer pays your medical claims. Be sure to underscore to your providers that you may have a better benefit if their cost is reasonable. And oftentimes, you may be able to have certain medical procedures covered at 100%, saving significantly on your out-of-pocket costs if they're willing to match a bundled cash price. Finally, remember to always check network participation, and if you choose to use an out-of-network provider, ask the provider if they're willing to accept your plan's Medicare reference-based price as payment in full without balance billing you. You will receive a member ID card sleeve to slip over your current member ID card with information about the KPP-Free program. It also has the telephone number and web address to contact Advantage Health Plans. You can access details about your claims and status of your annual accumulators by visiting AdvantageHealthPlans.com and logging into your secure member portal. Thank you for joining me for the Employee Education Meetings for Advantage Health Plans Trust, and thank you for being a participant on this self-funded benefit plan. We are looking forward to working with you in 2019.